undergone some transformation to ensure privacy protections are in place for participants.
It's not complete if we don't also really emphasize the access to the data and that the communities themselves can, represent their own health outcomes and interests through researchers from within those communities.
Certain communities may carry a disproportionate burden of disease, but without researchers from those same communities being able to ask the most relevant questions or being able to access that kind of data, it can be very difficult to make advancements.
We know how important it is for our populations to be involved in this research.
A researcher can get access to the tools and the data they need to conduct a project with our resources in as little as 2 hours once their institutional data use agreement is signed.
There's a publicly available data browser to see whether all of us offers data related to the condition or populations of interest to that particular researcher.
We're building this for researchers from across the spectrum, from all levels of their career, from all institutions. We're bringing them to the table, we're designing it with them.
Anytime I asked a question, the support team would get back to me very quickly. They're adaptive and responsive to feedback.
It's key to understanding how we can improve, what data elements we should consider prioritizing, what analytical tools we should consider prioritizing.
It's really critical that we bring folks to the data, make it easy and accessible to them.
So that is what we do essentially. So we have it from the participants' perspective, where we're trying to get participants to participate in the research, and also from the researchers' perspective to get researchers to go into the workbench and gather the information. So that is my presentation. Do you have any questions?
I have a question.
Yes.
Hi, Mr. Teacher. This is Violet.
Oh, hi, Miss Violet.
How are you?
I'm good.
Sorry, could you stop sharing so we could see,
Sure.
be able to see who's asking questions? Yeah, that would help. Thank you.
Yeah, if you participate in the research, is there a way for you to do you get your results?
Yes. 1 second. I'm trying to stop sharing here. There we go. Yes, there is a way for you to get your information. So the information that you provide, like I said, it's completely up to you how much you provide. You can go in and do as little as just a survey, or you can do the health all the way up to genomics. You can tap in with your primary care physician for them to share the data, or you can go to one of their clinics and have them do, for example, if you wanted to have lab work done, they can do it at one of their clinics that they send you to have that done, and you can get your information. Now, if the information, so you can get your personal information. Once the information is in the workbench, you won't be able to differentiate your information from my information, because they have decodified it so that persons are confidential. So even with, for example, I'm in the control tier, so I have the highest access. When we're doing data in there, pulling the data in there, it's all coming in sequence and codes. And that's why they have different tiers, because you have to go through different levels of securities in order to. Now, as far as with my institution that I do it with, you have to go through ethics training, you have to go through research. I actually have a researcher certificate to be able to conduct human subject research. So various organizations also on top of that have additional safeguard. I know with my institution that I do my research with, they have designated 4 computers for me, because I can't take my computer. I can't access it from my computer at home, to make sure that it's safeguard. Not everywhere has that, where they have that, but my institution has that. So I have a designated computer which is safeguarded, because you are accessing the National Institute of Health.
So can you send us the information to access the research if you want to join in the research as a
So if you want to join in as a participant, Do you mind if I share again real quickly? Share.
It's on the website. It's okay.
Okay, so if you want, I'm sharing the website. This is the allofusnih.gov. So you can join if you wanted to sign up for it. There's a different website if you wanted to go in as a researcher. It's the same thing, but then it's gonna be uh, forward slash. Have me not send it to the right place. So if you Okay, so if you want to go in as a researcher, then you'll just put the forward slash research on it to sign up. But like I said, you have to have a specific institution, a not-for-profit organization. And once you request access, they'll do the verification and all, and then you'll be able to go ahead to proceed to be able to initiate a DURA, which is an agreement to enter the workbench and do research. But if you just wanted to go in as a participant, then this is the website you would go into. You would sign up, put your email address, and then they ask you a series of questions and so on. And then you can determine, do you want to do survey? And they'll also send you emails to say, let me stop sharing. Do you want to do surveys? Do you want to do vitals? Because you can track vital signs. The survey questions ask you questions about where you live. It could be about work. Some of the questions that are in there about work has to do with, how secured is your job, how your employment status, how long it took you to gain employment. When some of the questions about where you live could be, how safe is your neighborhood? One of the major research that's actually taken place in the workbench has focused around heart disease and the lack of sidewalks. And that actually came from a combination of doing surveys to see if patients lived in areas that had sidewalks, because what they found is if you're in an area without a sidewalk, you're less likely to go walking, i.e., you're more likely to have obesity, heart disease, and etc. and etc. So those are the kind of information that they're gathering on the basic level, but on the more advanced level, they're looking at genomics. They're looking at diseases, and tying things back to ethnicity, and so on and so forth.
Okay. Dr. Nikisha, can we have a copy? Can you send me the copy of the presentations I could share with the members?
Sure, absolutely.
I have one question. Can you speak more on the participant engagement? How are you reducing the medical mistrust?
So we have different groups that go out into the community. Most of that is done through like I said, the young lady in Miami, by going into the community, talking to them about research, talking to the community about the improvements in research, and just understanding what were some of the barriers. And that's one of the caveat to have in our discussion tonight is, how can we partner with Kiwanis to get into the community, into your networks, so that we can have those dialogues with individuals who the mistrust has been there. Besides Delta Sigma Theta, there are other organizations that are a part of the D9, which are also members of the NIH All of Us Workbench. Because, of course, with anything else, if you're going to go to a community, it's easier to speak to somebody who look like yourself. And I think the most important factor also is to let the community know that we are the ones that are in the workbench. I can tell you like I had to go through rigorous screening for my institution to be able to give me access to the workbench. I was actually I was actually the one that spearheaded them in that direction, and now there are others. There is even also a All of Us research program convention that's coming up in April, and what that does, it's actually virtual, and persons who have done research in the workbench, present the findings from their research, so persons can see how they can access and what information they can gather from that.
Thank you so much.
You're welcome.
So, it's been very, very informative. I'm also in clinical research. I'm more active in the actual research on patients and volunteers. So this is also very interesting. And unfortunately, we have limited time because we have to be out of our
I understand.
meeting place by 9. But if we just want to wrap it up, do we maybe have time for one more question from anyone?
Dr. Ogilvy, have you worked with the focus program through Gilead Pharmaceuticals?
No, I have not. Not me personally. I have not. But I
You've
am.
heard of them though?
Pardon me?
Have you heard of them?
Yes, I have. I actually sit on the board of a not-for-profit that started as an infectious disease organization. They bridged into primary care over the last few years, and I also actively participate in the Palm Beach County Care Council. So I'm familiar with them. I just have not worked with them personally myself.
What I've asked is, what they're doing is routinizing HIV testing for patients coming into the ER. So once they're above 18 and having blood work done, an HIV test is done on them.
Mm-hmm.
And, depending on the result, and hepatitis B is done, and also based on various protocols, they're doing syphilis testing as well.
Right.
So that will help to identify patients who are suffering from these diseases and are unaware.
Right. And I think, research have shown with HIV in particular, persons spread it, one, because they're unaware of the fact that they are infected by the disease. And unfortunately, as high as the percentage is for the African American community, in Palm Beach County, the statistics is 1 in 41 person is HIV positive. As high as that statistic is, it does not include those that are HIV positive and are unaware that they're HIV positive. Any other questions?
Well,
I know you're pressed for time, so I will stop and give you back some of your time so you can exit the building by 9. I understand how that works.
Thank you, Sasha. Appreciate it.
You're
And
welcome.
we'll be in touch and follow up. And thank you
Absolutely.
again for taking the time out to present this information to our members.
And I'll forward you the presentation for you to share.
Okay, and you'll put in there the website
Yes.
for those who want to participate.
Yes.
Thank you so much.
You're welcome.
Back
Thank
to
you.
Carol.
Okay. Have a good night,
And you're
everyone.
welcome to stay forward for the
Okay
rest of the
then.
meeting if you would like.
I will. Thank
Okay.
you. Okay.
Great. See you soon.
thank you very much. We all heard the scary stories about research. Now it's
What's good thing about